Good afternoon, everyone. Thanks for joining us before we get into the holiday week. It's my pleasure to introduce Dr. Elena Alston, who came down from University of Washington. I reached out to Elena to come down after having a conversation with Chris Simpson, who had reached out to me because I have a couple of research associates who had gotten funding through their PTOP or their professional training program. And, you know, we're relatively close, and I know, Leslie, you have the same experience where we're all trying to figure out ways we can better work together, given we have, you know, such great resources so close by. And so he's like, you know, let's have someone down. And I was like, oh, look, someone else is doing firefighter work. This seems like a great opportunity to work on some connections. So thanks for making the time to come down here. I feel like we had like a handful of people who were coming from Harvard. She did her her training through Harvard, and so I don't know, perhaps you know David also probably through now at this point. I would also I'm gonna know him, but yeah, okay. But yeah, so yeah, I look forward to your presentation, and hopefully we can continue to grow relations through the two.
Thank you so much. It's really a pleasure to be here. As Nicole mentioned, you know, there's more and more connections, I think, as both of our institutions have that mission to serve our state and the workers of our state and really address issues of occupational health within our populations. And there's so much in common. And so I think, you know, having the opportunity to meet a lot of you in person and really hear about your efforts is really exciting to me. Today, I'll be talking about some aspects of occupational exposures in firefighters. This is a hugely complex world, and many of you, I'm sure, have already been thinking about this from a number of directions, and I would love to hear more at the end of the presentation about some of your thoughts. There we go. Just a little bit about me. So I'm an assistant professor in the Department of Environmental and Occupational Health at the University of Washington. I graduated from the Teach Chan School of Public Health, and my training is really in exposure assessment. And the more I do work in exposure assessment, you know, I start off with data, the more it turns into community work, and the more it turns into workplace engagement. And it's really interesting to see that a relationship between my training, which was really quantitative and measurements based, and some of the projects and interests that I have now. And so now I'm really passionate about this idea of providing data and measurements on human exposures in workplaces and communities that support health and allow for evaluating public health policy. What I'll be presenting here is some of the approaches I've used with firefighters, but it's been repeated in a number of my projects. And it's really been interesting to me how all throughout the phase of developing research projects, from hypothesis generation all the way through to research translation, that connection with the partners has been really formative. And then I have a picture here of my daughter. I also love hiking, backpacking, and supporting my two kids' hockey teams. I won't be talking about this too much today, but I also wanted to highlight the Pacific Northwest Agricultural Safety and Health Center that's based at the University of Washington. This is a NIOSH-funded center, sister center really to the total worker health centers that are here. And I put the link up for you because we do have pilot projects that are funded on an annual basis. Leslie Hammer had a great successful one last year, and we welcome regional projects from any of you if they involve worker health and safety in the agricultural space. Okay, so the work that I'm presenting today, we had a number of partners. There was myself, there was Marty Cohen, who leads our field group at the University of Washington, actually goes out into workplaces and does measurements and consultations on exposure. And then we had 3 master's students who have since graduated, whose work is being presented. So really this work in firefighters came about through a request from the International Association of Firefighters, as well as our Washington State Council for Firefighters. And they really wanted to understand what are the exposures that are taking place in the firefighting workplace, and what can be done to reduce the risks associated with those exposures. And we used a collaborative approach to identify research questions, share findings, and then develop next steps. So here's one of our partners who approached us. There's a lot of fear right now with firefighters. So this is a quote from him: "The cancer is the greatest occupational threat faced by firefighters." I don't think that's what most of us would think, right? When you see a burning building and flames shooting out the window. But more and more firefighters are directly impacted, including Neil here, by cancer diagnoses. They're experiencing cancer in their fellow workers. And it's also more and more on the data side emerging that there are these increased risks associated with firefighting. And so what are those risks? So in 2022, the International Agency for Research on Cancer actually classified the occupational exposure of firefighting as a known human carcinogen. And that was based on a number of factors, but included evidence of both increased incidence of cancer in firefighters as well as increased cancer mortality once they were diagnosed with cancer. And there are a whole slew of factors that likely contribute to that elevated risk. So it's not one individual factor, which is why they looked at the occupation of firefighting as a whole. And it includes the physical hazards, the chemical hazards, biological hazards, especially as more and more firefighters are being involved in EMT type work, and then psychological hazards. All of these contribute to the cancer risk, but also other known risks, including cardiovascular diseases, respiratory diseases, and mental health disorders. And so, for example, firefighters have substantially more diagnoses of PTSD. They have substantially more sleep disorders and a number of other mental health related disorders that actually some have already been linked to carcinogenesis or lack of ability to respond to chemical exposure. So these things are all interconnected. In this particular project, we're really going to be thinking about chemical exposures, and one chemical exposure in particular is polycyclic aromatic hydrocarbons, or PAHs. And these are compounds that are generated through incomplete combustion. And any organic material that is combusted in an incomplete way will generate a range of these PAHs. And there's hundreds, they're just these cyclic compounds. And in particular, the Environmental Protection Agency has designated 16 PAHs as high priority pollutants. Those are the ones that we'll be considering throughout this presentation. But as I say, it's just 16 of hundreds. One in particular, benzoate is a known human carcinogen, which again plays into some of the roots of exposures that are thought to link firefighting as an occupation to excess cancer. These findings for firefighters are scary. And so, going to meeting with our firefighter partners, trying to share with them the goals of our projects and other projects. They're scared. They hear cancer, they hear illness. And so what I hope to do in the projects that I'm engaging with firefighters is give them actionable items that will decrease exposure, that will reduce the time that they're exposed, and also the intensity of that exposure. There are also many other support networks within the firefighter community that try to address some of the stresses, some of the concerns from an engagement and community standpoint. Taking a step back, how did I get involved with firefighters? I was asked to participate as a site PI in a larger national project called the Firefighter Cancer Assessment and Prevention Study. And this was a study that was funded from FEMA to look at and recruit firefighters into a 30-year cancer cohort study. And so firefighters from all over the country are being recruited into this into the study. We're collecting baseline measurements on both physical stressors, mental stressors, training, and following this cohort over time, hopefully. This was a really great effort. It was fantastic to participate in it. On our site, we were particularly focused on volunteer firefighters, which is actually an underserved population of firefighters, even though up to 70% of our firefighters in this country are volunteer. But again, it didn't lead me to that actionable, like, what can we do now? And so it was a really great process. It was great to go and recruit these individuals, collect the samples. But it was also difficult because a lot of people were saying, well, we don't want to wait 30 years to find out what our cancer risk is. We want to act now. Some of the findings, though, from this study, which are still being published, are that just at the baseline stage of recruitment, there were some important differences in lifestyle, stress, access to medical care, and cancer screening across firefighters by region, and also comparing firefighters to the general population. There was also quite mixed results with respect to that baseline exposure, biomarkers of exposure. And so we were looking particularly at PFAS exposures in firefighters, as well as PAH exposures in firefighters. And we didn't see, although there was a lot of concern, significant increase in PFAS exposures at baseline across these volunteer firefighters that were recruited. We did see some evidence of increased exposures to PAHs in the firefighters, but again, there was a lot of variability in that baseline exposure. And to give actionable information back to the firefighters, we might have to wait a significant amount of time to provide that impact. And we also found through asking about behaviors that prevention practices and adherence to best practices was highly variable. And so this kind of initiated this thought that really by preventing and acting now, we could give back more information and prevent the occurrence of disease now. And so we reached out to some collaborative partners. The first was the Washington State Labor and Industries, which takes care of our workers' compensation program. They have also observed higher incidence of certain diseases within the firefighter population and initiated this firefighter collaborative to actually try and reduce those exposures. They funded our group through their SHIP grant program to do the work that we're going to present today. We also reached out to some firefighter unions, so the Washington State Council of Firefighters and the IAFF. These are groups that provide best practices and also do outreach on prevention to their members. We identified some local fire departments, fire service partners that were willing to collaborate with us to actually collect samples from firefighters as they do activities, so we could evaluate exposures in training scenarios. So we went back and forth, right? How are we going to collect information on intensity and duration of exposures in firefighters, given that their call volume is highly variable, the types of calls that they respond to are highly variable. And so for the project that we're going to talk about today, we decided to do a model where we were going to recruit from a fire training academy and do samples during their live burn events. And then we also interacted with this firefighter cancer cohort study partners on the dissemination and outreach. Okay. So what was the question that we wanted to tackle, right? I'm talking about PAHs, I'm talking about cancer, I'm talking about fires. What did the firefighters that we interacted with as part of this collaborative process actually want to know? And I was actually surprised by this. So the first question they wanted to know was, what gloves should firefighters use during cleanup activities? And I thought, well, Isn't that already something you know? Why is this a research question? It turns out there's a lot of variability both in the gloves that firefighters are using for cleanup activities, and these are activities that happen after fire suppression is over. And there's also not a lot of clear guidance from our national and local best practices partners as to what gloves should be used. And so there was this gap, and firefighters are really struggling. They also wanted to understand what factors influence the post-fire glove use. So just in their practice, have observed many different options being used by their colleagues. And they wanted to know why. Why are some people choosing thin rubber gloves versus structural gloves, for example? Why are some people choosing leather gloves? And are there actual differences in exposures that occur? And so the phase that we're going to be focusing on today is what's called your demobilization. And so if you think of a fire, the first step is the fire suppression. You actually go, you fight the fire, and you extinguish it. Following that process, there's a field decontamination, and that's a process where it's a gross decontamination of the PPE. They use water and brushes to remove large sooty elements, and then actually remove their PPE following that process. And then before they can complete their activity, return to the station, in this case, it's the fire training academy, so go home for the day, they actually have to stow away the hoses, any equipment that came off the truck, put everything back on. And so there's this phase here where they have to decide what PPE to put back on for that demobilization period. Okay, so the first question we wanted, the first phase of the project was to understand what's the current behavior. We weren't getting a clear sense of how are people currently approaching this phase. And so we developed an online survey to distribute to partners, and it consisted of 14 questions related to glove use during demobilization, the reasons those gloves were being selected, the frequency of post-fire decontamination behaviors. So there are clear recommendations for what types of decontamination to do at various phases of fire suppression demobilization. So we want to understand if those were being adopted. We also want to understand health beliefs. So if people are more concerned about cancer, are they more likely to use a certain type of glove? Are they more likely to be aware of best practices? And then some personal and job characteristics. We developed the questionnaire within the health belief model framework. So we really want to understand what are people's perceived susceptibility and severity, benefits, motivations, and barriers to using gloves during their demobilization activities, and what are the characteristics that modify those beliefs, and then lead them to use a particular glove or a particular approach to PPE during demobilization, and eventually, how does that potentially impact occupational exposures? So we sent this survey out with assistance of the Washington State Council for Firefighter. That was really instrumental in getting anyone to respond. So before they did their outreach, we had actually emailed, I had a graduate student do this, I think 92 different fire departments within Washington State, got very few responses. And then we actually got the safety committee from the Washington State Council of Firefighters, as well as their safety officers, to send out newsletters and reminders to the membership. And we ended up getting 364 participants representing 62 departments across the state. So we were quite pleased with the response. Reflecting the distribution of firefighters, we had almost 90% male respondents, and most of them were over the age of 30. We also had some interesting data on fire calls. This was not a normal distribution. So 40% of the firefighters had 0 to 2 calls per month, which is very low. And then we had upwards of 30 in some of our respondents. So it was a very long tail of that distribution. We had a range of experience or tenure in the fire department. Because of the way we did the outreach, we had mostly career firefighters, even though, as I mentioned, in the state, almost 70% of our firefighters are actually volunteer. And we had a good representation in rank as well. Okay. So the first question was, do they use structural gloves during demobilization? So their structural gloves are the gloves that they're assigned to use during fire suppression. These are very thick gloves that have fire resistance. And we had been told before this that all firefighters use structural gloves during demobilization. That was kind of the official line. So we found 28% were actually using those structural gloves and 72% were not. And of those not using structural gloves, we had quite a range. 30% were using leather gloves, 20% mechanic, and then we had a range of other solutions that included no gloves. So we had 5% of people reporting no gloves used during that phase. This will come up later in the presentation, but for those 28% using structural gloves, this is not a fresh pair of gloves. This is the gloves that they were using during the fire suppression, which becomes relevant because there's not an opportunity to decontaminate those gloves before they're putting them back on. Okay. This is just the same. We can skip that. And so then we asked them, well, why are they using these particular gloves? Interestingly, for most firefighters, they were picking the gloves based on their functionality and their physical protection. So protection from cuts, abrasions, and other things that could happen. In fact, when I was at the Fire Training Academy during sampling, I saw one of the trainees had a giant gash along his palm, and that was something that occurred during demobilization because as they're rolling the hoses, they actually have to decouple the hoses, and often those metal connectors have burrs on them. So when they're twisting them to remove them, they can cut themselves quite badly. Yeah.
Yeah, I'm just curious. Does each individual firefighter get to just choose their own glove? Like, well, I like gardening gloves and I like leather gloves.
So
I don't, or it's unclear if there's
so
some standard by department or.
So there is no standard for demobilization.
Okay.
And that's why this question came up. So during the fire suppression phase, they must use structural gloves.
Okay.
And those are assigned to them. I don't know if I ended up putting it here.
This is during demobilization.
This is only during demobilization.
Okay.
There's no standard specifically during that demobilization phase. So thank you for asking. And in addition, some departments, it was a question we asked, do supply leather gloves or mechanic gloves specifically for demobilization, but it's very few. So all of these other options that you're seeing are firefighters that are bringing their preferred glove with them to the scene. What we found also was about half of firefighters were picking gloves based on comfort and range of motion. Those are usually the firefighters who are selecting leather or mechanic gloves, because again, those structural gloves are not comfortable. I should have brought a pair for show and tell. Less than 1/5 were picking them for chemical protection reasons. Oh, I think I do have it here, so I missed this. So only 41% of firefighters were picking gloves because those were the ones provided by their department. And mostly those were being reported, those were the structural glove users. So they're like, that's the glove I have, that's the glove I'll wear. And so in our top reasons, again, this is consistent, the structural gloves are being selected because they were provided by employers, they were there. And then the leather gloves and others were being picked because they were well suited, they were comfortable, and they offered physical protection. Sorry. All right. We also asked about best practices. So there are post-fire best practices, again, related to hand washing, gross decontamination with a brush, and other ways to reduce exposures. Only 56% of our respondents were actually familiar with these best practices, 44% were not. And then not surprisingly, those who didn't use gloves at all were the ones who were least familiar with those best practices. We also asked about decontamination behaviors, and again, these are all best practices that are recommended. We found that washing with soap and water, this is after they returned to the station, was the behavior that was most performed in this group. But other behaviors such as wipe washing of the hands in the field, and this is using pre-moistened wipe or a baby wipe. I think they actually have a brand called Hero Wipe for firefighters, so it sounds, nicer than a baby wipe. But it was not something that was adopted by all of our firefighters, so clearly room for improvement. And then this element here, which is hand cleaning of gloves, that's a behavior to adopt after you return from the fire to decontaminate your gloves for the next deployment, and that was really not widely adopted. Okay. Next. We also wanted to try and understand how kind of this perceived risk of dermal exposure interplayed with their knowledge of best practices, as well as their implementation of some of these exposure reduction strategies. And we found that the highest perceived risk was amongst our users that used medical gloves, so nitrile barriers to chemical protection. We also found that in terms of understanding like cues to action, so looking up information on decontamination procedures, understanding and decreasing barriers such as discomfort and time and so on, those kinds of behaviors were also most reported by the medical and leather glove users. And the perceived barriers were reported as high amongst those who use no gloves. So people who were going in the field, not using any gloves, any protection, they perceived the barriers to implementing many of these practices as very high. Then we kind of put all this together to try and really understand how these different factors interacted with the employer influences and individual influences. And we kind of identified that individual factors such as glove choice and health belief really lay in this individual influence sphere, but in terms of identifying and training people on the knowledge and use of best practices, and then also having gloves available that met the needs of the firefighters, so that dexterity needs and the comfort needs really lay within that employer influence. And so this is where we decided to focus the next stage of our research. Okay, so the next stage was really a summer project. Yeah, go ahead.
So in that survey with elevation items, things like that, did you also measure or establishing of the way what was the training when they were at the station? What did their receptor, whomever, like?
Yeah, so we went through questions on different aspects of that demobilization practice, whether they were aware of it and whether they had received training on it. And that's where we did see quite a bit of variability. And so there were, I think it was only 55% reported having received that training and those best practices. I don't know if they all received it and didn't remember it, or, it's hard to know from the survey, but there was certainly room for improvement. Yeah.
Yeah, certainly. I think that would be an intervention point, right?
I agree.
That's training.
I agree. I mean, they receive a lot of training, and we'll talk about that, but that training that's really targeting, I think I'm going outside my yellow fan, that's really targeting the reduction of the intensity and duration of the exposure through the decontamination is definitely a need. Yeah.
So, let's discuss this one.
Be that in context of firefighting that there are group leaders who are, proper terminology, but when you take a survey, have a wide range of experience and number of years of service, do you see that if you have a trend where a chief leader is having a certain practice, that then has a follow-on with those that might be younger, less experienced, and so how much influence do that type of leadership and the things they bring, so that, or is it much more still?
Yeah, so we had that question as well, and so we clustered everything in our analysis by department and rank. And we actually found much more variability both within department and within rank than we expected. And I think, again, it has to do with this particular area not having concrete best practices. So it's a very hierarchical organization structure, and they train following these best practices guides. And so because there's a gap here, there seemed to be a lot more variability in how this was approached. So I'll go a little quickly through this, but our next question was like, is there really a difference just in that strict usability of the different gloves? Because we had that question from firefighters. They were worried about the structural gloves not providing enough dexterity. That's why a lot of people were bringing their own. And so we did this in the lab, again, because of the difficulty of reproducing across glove types and people activities that are occurring in a not super standard area. But these are the types of activities that they're doing. So, you know, they're coiling hoses, they're lifting hoses, they're laying them flat, and then they're coiling them back into the trucks and cleaning debris. And so we used a series of 4 tests that are recommended by the NFPA, which is the National Fire Protection Association, to evaluate structural gloves. And so we set up 4 test stations. One was a glove tool test apparatus. This was using a wrench to set up these bolts. The other was a torque test. So it's gripping a slippery pole. So see here, it's a vertical pole, and then torquing it as with as much force as possible. The third was a glove pegboard test. And so this is a fine motor skill. So you have to take these little pegs and put them into the board as quickly as possible. They like doing this one. And then the last one is this, a pull test. So this is a fiberglass pole that's actually wetted, so it's slippery, and then they have to pull down with as much force as they can without slipping. And interestingly, what we found in this test was that the best performing was what we call a nitrile layered leather glove. This was a glove combination that was one of our partners requested that we evaluate, and it was because all firefighters have available to them EMT gloves on site. And so it's simply a nitrile glove underneath a work leather glove. And we found that the structural gloves provided low comfort and low precision, which is probably not surprising. I didn't share here, there was a difference across hand sizes. And so the larger hand sizes actually had less difficulty with the structural gloves. And it's related to that difference between the hand length and then the thickness of the glove. So if you have a longer hand, you're more able to adapt to the thickness of the glove and use it with less discomfort. Okay, so the last question was chemical exposure. So we've kind of gone through, we've identified that firefighters are using a large range of possible glove types. They're not really picking those gloves based on chemical protection. They report being worried about chemical exposures. Structural gloves in theory are providing a barrier to chemical exposures, although we'll talk about that a little bit more later. And our question was, well, how does using a different glove type impact exposures during that demobilization phase? And so to do that, we recruited firefighters at 2 different live training events. And this was, again, critical to have that partnership with our local fire service. And we recruited 21 and 24 participants at each live fire event. And we had pretty simple inclusion-exclusion criteria. The first, they just had to be adults. They had to be affiliated with the fire department, which they were by definition of being there. And then we excluded anyone who had smoked tobacco products in the previous week, just due to potential pH contaminations on the skin. And then the goal was to look at on-skin pH exposures following a few specific time points. And so we had a sampling time point that occurred after wearing a used structural glove. So the firefighter had fought the fire, taken off their glove after gross decontamination, decontaminated their hands, and then they just put back on that structural glove as they normally would. But we did not have them do any demobilization tests. They just manipulated their hand in the glove, and we took a sample following that activity. We took a sample after gross decontamination. So this is, they finished fighting fire and they've performed their gross decontamination. And then we took samples after they performed their demobilization tests, and they were assigned particular gloves for that demobilization activity. I think I'll kind of skip here, we can see where these happen. The one thing I do want to point out is we ended up doing 2 kinds of post-decontamination samples. We did one kind where they followed their best practices and did their decontamination, which included this baby wipe, pre-moistened wipe use. We realized that we were getting highly variable measures, so we did a second set of samples after the researchers did the gross decontamination. So we called it post-decon. All right, oh, sorry. And then we tested a number of, we couldn't test all of the possible glove combinations that we found in the survey. There were just too many, but we selected structural gloves, leather gloves, and then this nitrile layered leather glove. And so what we did as comparisons, we compared the post-wear, post-decon, and post-decon by researcher samples, and then we compared the 3 different glove type samples. We also wanted to frame our findings in terms of overall cancer risk. So we used the on-skin dermal exposure to benzoate pyrene, which is a class 1 carcinogen, and calculated out based on the number of fire calls and the time spent in demobilization. We calculated out a lifetime cancer risk associated with the exposure. For the pH quantification, we used our departmental environmental health laboratory and analyzed the samples by GC mass spec using the EPA method for pH analysis. All right, so the first important finding, I think, was we found substantially different on-skin exposures to PAHs when the firefighters were doing their decontamination as compared to when the researchers were doing the decontamination procedures. We didn't do anything particularly differently other than take a lot of care and some time and making sure to wipe the hands, all of the surface of the hands. And so we found, a significant reduction in that exposure when the firefighters were doing it. We also found evidence of cross-contamination. So when the firefighters were simply putting back on the firefighting glove that they had used during fire suppression, we saw higher on average pH exposures than we had seen during following the decontamination. So this has been really impactful for our fire service partners. We've returned this information to them. And, just seeing that you can cut exposures and the duration and intensity of the exposure just by using a baby wipe carefully is really, it's impactful to them. And they're actually planning to incorporate this information into future trainings.
Quick question.
Yeah.
When you say carefully, what's the duration of the blood?
What did we do?
Yeah.
Yeah, I mean, it was not particularly long. So we basically did a serpentine wipe on one side of the hand, the other side of the hand, and then between each finger. That was what we did. I took 20 seconds per hand. So, but I think what the firefighters were doing is they were taking the wipes and kind of like so. It just wasn't as intentional to get every surface of the skin. We also compared dermal exposures during demobilization. So I think the first thing to note here is we had hypothesized, and in talking to other research groups, that we might not even pick up pH exposures during demobilization at all. Because again, this is not a fire suppression phase. This is a phase of rolling hoses at the end of their activity. How would pHs be getting on their skin at all? So it wasn't clear that we would find any. And in fact, we didn't find particularly, and I'll put these in context later, we didn't find particularly high exposures, but we did find that for both the structural glove and the leather gloves, we had significantly higher exposures than when they were using the nitrile layered leather gloves. For this structural glove finding here, we actually were not providing new structural gloves to our firefighters. So there's the possibility here that some of what you're seeing is actually that cross-contamination component. The leather gloves here were new gloves. And so here, the exposures that we're seeing are likely through either permeation through the leather glove or entering of dirty water essentially through the cuff. So then we converted this to a lifetime cancer risk, and we did this, I think, fairly conservatively. So we used an EPA skin permeation factor for on-skin pHs, and we assumed 4 calls per month for a firefighter over a 25-year career. That was very much in line with what we saw in our survey. We assumed that the demobilization activities would take approximately an hour for each event. And again, what we see, we don't see huge lifetime risks, but we do see for both the structural and the leather glove that that lifetime cancer risk exceeds 1 per 1,000,000, which again is not an occupational risk threshold, that's a population risk threshold. But we saw really a substantial and significant decrease in that excess risk just from carefully wiping the hands and using a nitrile glove. And again, I think this was particularly impactful when we returned it to our fire service partners, because this is an actionable way that they could incrementally decrease exposures throughout their lifetime. So key findings, we're reporting back to our partners that the best gloves to use are these nitrile layered leather gloves, that they're optimal for both comfort and protection. We really want to move forward with this thorough decontamination point, which is really applicable across all phases of the firefighting activity, that the exposure to these carcinogens is scary. But again, that intensity of exposure and the duration of the exposure is really what's going to drive their risk into the future. And so cleaning hands with soap and water as soon as possible, full body showers after returning from the station, and careful application of pre-moistened wipes really can make a substantial difference to their exposures. We're also thinking of partnering. I'd mentioned the Panache Center earlier. We have training that's been developed through the Panache Center that's aimed at pesticide applicators that looks at this cross-contamination using fluorescent dye. So people go through their activities using a tracer that's not visible to them in the moment that they're doing the training. And at the end of the training, you can use a black light to show where cross-contamination has occurred or where decontamination has not been effective. So this is an area that we're hoping to explore more with our fire service partners. And then really working with them to identify ongoing training and education efforts that can both propose effective practices and effective training solutions, but also identify some of the barriers to implementation. And we know some of them. There's time, there's just the organizational structure of how they train currently. I think there's another barrier here, which is the fear. So I think a lot of firefighters, again, they reported in our survey that they are concerned about chemical exposures, they are concerned about cancer, but I think sometimes acting on those concerns, it's easier to ignore them, I think. And I'm kind of seeing that in talking with our partners. It's easier to ignore the risk or just say, well, it's part of the job, than to try and incrementally go and reduce the possibility of that impact. And so just messaging it in a way that doesn't trigger that experience. All right, so I think my message is we do have tools that are existing and that we can continue to develop to make firefighting safer. But really, as this and many other projects probably that have taken place here, the collaboration is really the only way to both identify those risks. I mean, I would have never known to even think about this particular phase of firefighting activity, but it's also critical to actually implementing solutions that work. I also think that collecting data is really important for our partners to be able to advocate for ongoing research and funding. So we might know that pH exposures are occurring, but actually having comparisons between different exposure scenarios really lends additional voice. And then really, continuing to think about making safety a priority at every level of the fire service and not accepting that these increases in PTSD and cancer and all these negative outcomes are just part of that job. And lastly, this is a quote from another partner in this project, Kevin Rajecki, who is one of the safety leads at the Washington State Council of Firefighters. And, he says legislative improvements help provide benefits, but cancer is still debilitating and often deadly and changing the course of life for too many of our members. So again, this is a deeply personal issue for so many of our firefighter partners. I'd like to thank Washington State Labor and Industry SHIP grant that funded this work. I think I'm supposed to say thank you here, but I guess it doesn't. So thank you, and I welcome a question.
Great, thank you. Yeah, great work. And, it reminds me of a long time ago, I was working with a foundry, and
Interesting. It's wild. I've done some.
They brought us in because lots of injuries.
Yeah.
And, it's a very dangerous work environment. And we learned from the workers that they did not like the gloves because they weren't comfortable. They weren't comfortable and they couldn't actually do their work. So they were replacing them with other gloves that were not as safe.
Yeah.
But we then worked with management to identify different gloves that they could actually manipulate, and use more easily, and that were still effective. But we also learned during that project that there were a lot of eye injuries.
Yes.
And people were not wearing goggles. When we asked them why they weren't wearing goggles, well, we don't really need to, and my supervisor is not, doesn't really wear goggles either, so why should I? And this was a long time ago. Okay, well, very long. I'm going to tell you how long ago it was. But it does bring us back to the role of, the supervisor and the leader and the culture, the safety culture. And so are you going to integrate, in future research more around kind of what does your supervisor do? How does your supervisor value safety? What is the, safety culture? And we know literally that safety culture impacts behaviors. And so it just seems like a natural.
I think it's a great idea and a great next step because especially in this, I mean, all workplaces, you rely on your manager. In firefighting, I mean, it's really paramilitary. I mean, I was almost surprised at how paramilitary it is. So there is very much a rank and an order and that influence of that direct superior and, commander. So I agree. I do think that is very important. And again, I think it's interesting that for this kind of topic that falls outside the very structured part of their response, it's almost like the wild, wild west. And so understanding how individual chains of command might, that would be really interesting.
I have a question, and it goes off on this point, I think. And then I see that Steve, you had a hand up. But however receptive were they of those findings? I imagine immediately, like, okay, I need to clean my hands a bit longer, but then, like, and I don't know how recently you presented to them, but like, have they started making changes so that would make it something that can be longer over, so that the chiefs or the captain on duty will make sure that they're monitoring how people are washing, or some things like maybe they actually somehow meant actually washing their hands at the site.
We can talk about that in a second. I'll answer that and then I can take the online
Okay,
question.
we're going to the super shake, yes, question.
Yeah, so I'll just take this one and then I'll take that one. So, we actually just finished this phase of the project and presented it to our partners just 2 weeks ago. So it's still very fresh. It's a very biased rule because the people who show up are all the safety officers. But they thought this is great. Now, when we actually go to the Fire Training Academy, there's almost more instructors than there are students. It's a dangerous training. So there's many, many instructors. So we get to observe the behavior of those instructors. And, there's definitely an attitude amongst those individuals that it's just part of the job. Part of the job is to have soot exposure. And in fact, it's almost like a badge of honor. If your gear is too clean, you haven't been to very many fires, right? You're kind of a newbie in the firefighting world. So there's that badge of honor, like, okay, when we've had a hard day's work, we have soot on our bodies and on our gear. And I do think that some of these numbers and data and converting to things like lifetime cancer risk can actually help open up that conversation so that there's more of an understanding again about that duration piece, because I don't think that's something that is trained effectively right now in firefighting space. Yeah, I get the online question.
Hey, Stephen, you can unmute yourself and ask your question.
Yeah, hi, this is Steve Shea. Thank you, Elena. Can you hear me?
Yeah, thank you.
Okay. That was a really great presentation, and I understand the specifics of the studies that you were focusing on, but I was sort of really also interested in the original statement you made that, in a 30-year study looking at cancer risk, people don't want to wait 30 years to get the information and do the prevention. But so I just wondered about the context of that long-term study. How can you control? I mean, you have controls, but things are changing all the time as your policies and recommendations change. So can you tell me a little bit more about the context of studying the effects on cancer risk? I mean, I imagine one of the things you mentioned was like the expected exposure, accrued theoretically in terms of risk. Is that how that study is going to be done?
So I'm not leading that study, but the idea with that study, like many studies, it's planned to be a 30-year study, but they're recruiting in like 2-year funding cycles. So But what they're trying to do is actually collect biomarkers of exposures, not only biomarkers of outcome. So in that project, what they're hoping to do is actually look at urinary pHs, also look at metabolomic changes and so on over time. And so I think they're hoping to get around this issue that you're bringing up. The practices hopefully are going to be changing, exposures hopefully are going to be changing. And so being able to look at the association between changes in exposure over that long term and then those changes in outcome. I'm not sure if that answers your question.
Yeah. Well, it does. Interesting. Can't wait for the results if I'm still alive.
Yeah, well, I hope they continue getting their funding because, like I say, it's a really huge effort. I think they have, last I looked, 3,000 firefighters recruited across the country, and so keeping those samples coming in.
Right, but it's got 3 years of funding at the moment. Is that right, from FEMA?
Yeah, they usually do FEMA grants, which are 3-year cycles.
So. Thank you again very much. I really enjoyed the presentation.
Thank you.
In that vein, sorry, it's quick. In that vein, I wonder if you could work backward and ask someone that had been diagnosed with cancer what type of gloves they had been using, see if there was any relationship.
Well, maybe, but like to the point, practices are changing rapidly. And so, you know, at the fire training campus, instructors will say, when I was doing this, you know, we had no gloves and we only wore CBAs, you know, we didn't wear them in the staging areas, we only wore it in the active fire. And so there is quite a lot of change that's been happening over, good changes over the past 20 years. So it might be difficult.
We have time for another? Yeah, great. Thanks for a great talk. The question I have for you is actually based on a piece of information I just got from a colleague of mine, Heather Singleton at Duke, I know.
Yeah.
She also has a cohort in North Carolina that's
Yeah.
So she's finding also that the PFAS exposure is high, which is.
Yeah, she was on that thing.
Yeah, so you probably have all of the same data. But she, and so you may already know this. She's finding that the pH exposure, it may be coming directly from the turnout gear.
Yeah.
Maybe the decon procedure is not effective. Seeing your data, that firefighters may not be that great at washing their hands.
Yeah.
Maybe they're also not that great at washing their gear.
They are not.
Is there a way, do you think that's maybe a point where they could improve that and reduce that dermal exposure from the gear?
Yes, and so there's a lot of questions about that. How much is the gear actually recontaminating firefighters? So if it's not decontaminated effectively between events, can actually be building up contamination and actually making things worse. I would say still an active area of research, but it does seem like that is a significant and real concern. It's also a particular concern for volunteer departments, again, because in career departments, almost all have switched to having 2 different sets of turnout gear.
Yeah, that's what she told me.
Okay. But in the volunteer context, that's not true. And so, again, if you can imagine turnout gear, it's very bulky. If you do a full decontamination, it's wet and heavy, and it takes a long time to dry. So you can't really be doing an effective decontamination of your gear if you might expect to be going out again within a day, unless you have a backup set. So that is.
I'm mostly wondering if maybe the decon procedure can be tweaked. Maybe that's a plan of intervention too. Because if they're getting that residual exposure, you showed you could reduce the exposure so much just by improving the protocol. Maybe the decon protocol can be.
I think probably.
Yeah, sorry, maybe, like the University of Miami, they didn't really work on that. Like they're total work health, release the organization, the group that's working with firefighters follows total work health practices. And so they've been doing just lots of outreach and messaging, on that, and not taking things home. And, yeah, so people they're that group particularly.
And they have funding in Florida, I think, to actually do interventions on the rig. So they have like decon kits on the fire trucks, and they're trying to look at the differences and take on this kind of project. Yeah.
For your data collection, are the firefighters, could they be essentially those that are primarily fighting structural fires versus grass fires versus forest fires? And is there a lot of differences? Because I know during, wildfire season, that these would go on for weeks, months, time. And so for those folks that are just getting 0 to 2 calls, these are the ones who essentially get mobilized during the grass fire season instead of wildfire season versus if it's structural fires that are fighting, then that probably doesn't have the same peaks and valleys that you might see.
Yeah, that's a great question. That seems to be an issue, at least in Washington, that we're seeing more with our volunteer and accommodation departments. The accommodation departments have volunteers and career firefighters, and they tend to be in locations that have more of that interface between, urban and wildfire environments. And so they do get called in to fight grass fires and wildfires. And it's not something we're able to tease out in this project, but I know from talking to them that this does occur periodically and sporadically in their work. There's also just equal other pool of workers that are the wildland firefighters. They have different PPE, they have different gloves, they have different best practices. And so that's just a whole other group that probably does have significant, at least periodic exposures without necessarily all the best practices that could reduce those. And then in the urban environment, I think some of the emerging issues are related to like EV vehicle fires, like exposures from unusual fire sources. They're also worried about more and more buildings are having battery banks on the building, like for solar panels. And so there's concerns around exposures in that context.
Thank you. Time.